Hello and welcome to this JVI Evidence Implementation video commentary. I am Nancy Navarro, registered nurse and doctor in public health science from the University of Guadalajara in Jalisco, Mexico. I thank JVI and its network of collaborators for the opportunity they have given me to contribute on this occasion by commenting on the article Improving Care for Thalassemia Patients, in line with best practice standards at a tertiary referral cancer care center, by registered nurse Lailani Vongay and her collaborators. I encourage you to consult the full article, which is available in the JVI Evidence Implementation Journal. During my professional career, I have focused on cancer care and prevention. Therefore, I believe that this topic is of special relevance for nursing colleagues, since thalassemia is a disease that requires management for a long period in the life of the patients, and it's important to ensure that the nursing care provided is of high quality. According to the Center for Disease Control, thalassemia is defined as a type of hereditary and autosomal recessive hemolytic anemia, when the body does not produce enough hemoglobin. Therefore, there are fewer healthy red blood cells in the bloodstream. The amount of oxygen that this hemoglobin carries is insufficient, which generates the presence of anemia that can range from mild to severe. This causes the person to feel tired, weak, have difficulty breathing, or can even damage organs and cause deaths. In populations where malaria is or has been a public health problem, the occurrence of hemoglobin abnormalities, including thalassemia, range from 0.3 to 25 per 1,000 live births. Other determinant factors are the practices of marriages between relatives, accrued maternal age, gender, or founder effect. Although thalassemia has a higher incidence in Asian and Mediterranean countries, as well as the Middle East and North and Central Africa, it is mainly due to globalization that this condition occurs today in all populations around the world. On the other hand, it's important to know that there are different types of thalassemia, and by this we can refer to one of two aspects: the specific part of the hemoglobin that is affected, usually alpha or beta, or the severity of the thalassemia, which is referred to words such as trait, carrier, intermediate, or major. A person with thalassemia trait may have no symptoms or only mild anemia, while a person with thalassemia major may have severe symptoms and may need regular blood transfusions. This is why patients may require treatment and follow-up throughout their lives. However, frequent blood transfusion can lead to iron overload and toxicity, causing cardiac cirrhosis, pulmonary hypertension, and endocrinopathy, thereby making patient care more complex and require nursing professionals to have the skills and abilities necessary to provide evidence-based care to people with this type of condition. Okay, so this study conducted a clinical audit design and was conducted between June 2019 and June 2020. A pre-implementation audit was carried out following current best practice guidelines for the care of patients with thalassemia. Following the baseline audit, strategies to align clinical practice with the best practice were implemented. A post-implementation audit was conducted to determine the success of implementation strategies and changes in clinical practice. The sample for this project was 9 patients, and the same patients were audited pre- and post-implementation. The total number of nursing staff who participate in the project was 48. 5 audit criteria were developed from the best practice guidelines of the United Kingdom Thalassemia Society, 4 of them measured on patients and 1 more in nurses. Among the most outstanding results in this study, it was observed in the audit prior to the intervention that the criteria applied to the patients were not met, and on the other hand, there was no documented evidence that they had been done. Regarding nursing professionals, only 45% of the nursing staff had received thalassemia education within the last 12 months, despite 77% had provided care to thalassemia patients. Over 12 months, strategies were implemented to improve staff education using 3 approaches: creating a staff education folder, the delivery of virtual or face-to-face education session for nursing staff, and for last, the creation of thalassemia-specific nursing assessment and documentation template. In the post-implementation evaluation, the audit showed a 92% increase in the education received by nurses and 100% compliance with the criteria for patients. The project results demonstrate that ensuring an evidence-based approach to care improves the consistency of care provided to thalassemia patients. In my opinion, the vast majority of hospitals offer continuous training for nursing professionals. However, these are focused on training about physiological and therapeutic knowledge. So, the opportunity should also be provided for the nursing professional to learn strategies to improve their care based on evidence. That is, it is important to dedicate time to educate them on how and which are the strategies to implement scientific evidence according to the needs of each patient, especially in areas as vulnerable as oncology. Thank you so much for your time.